Okay. Hello, everybody. Good morning. I think we'll go ahead and get started. I'm very pleased to welcome you all to this workshop. My name's Karen Basen-Engquist, and I am the co-chair with Michael Paasche-Orlow. So we're just going to give a few words of introduction and then get on with the day, because I think we have a very exciting day planned. So the issue of health literacy, the National Cancer Policy Forum members decided this was really a very high priority area for us to address. In looking over some of the documents from the Health Literacy Roundtable, I found these principles from the National Action Plan for Health Literacy, that everyone has the right to health information that helps them make informed decisions about their health, and that health services should be delivered in ways that are understandable, lead to health, longevity, and good quality of life. And I think in the area of cancer, which is actually multiple very complex diseases with complicated treatments, this is a really big challenge. I think all of us who work in cancer research or cancer care have the experience of having to answer questions for our friends and relatives who are faced with a diagnosis or want information about cancer prevention. What's a phase 1 trial? What is targeted therapy? Why does my doctor recommend that I stop cancer screening at age 80? That kind of thing. And so, it's a very complex area. So we're really pleased to have this discussion today. So I just want to introduce the National Cancer Policy Forum to you. So the National Cancer Policy Forum is a group of individuals with a focuses the National Academies on cancer and addressing issues of science, clinical medicine, public health, and public policy. Want to also acknowledge, of course, our sponsors, to whom we're very grateful. Long list of sponsors, and we're very pleased today to be able to collaborate on this effort with the Health Literacy Roundtable of the National Academies. So the Roundtable on Health Literacy, their mission is to inform, inspire, and activate a wide variety of stakeholders and support the development, implementation, and sharing of evidence-based health literacy policy and practices. They've produced a number of reports here to help improve the health and well-being of all people. And we also, of course, want to acknowledge the sponsors of that roundtable. So with that, I'm going to turn it over to Michael, who's going to talk a little bit about the area of health literacy.
Yeah, thank you very much. So, we're here because low health literacy has been shown in a broad array of contexts to lead to worse health outcomes. And we're also here because low health literacy has been identified as an incredibly prevalent phenomenon, about 90 million American adults. But just to focus our attention a little bit, this is more than just making a better patient handout. It would be cynical not to do so, but this is going to be much more than that. So health literacy has been defined by Healthy People 2020 as the degree to which individuals have the capacity to obtain, communicate, process, and understand basic health information and services needed to make appropriate health decisions. But this is only one of many definitions out there, and I really don't like this definition, and I'm going to just complain a few things about it just to clarify and to focus the conversation and maybe propel the conversation during the day and a half that we have together to say this is more than that. So it's not just basic. What's basic to me is irrelevant to another person. If you're facing cancer, you have to deal with very, very critical decisions in your life that are complex and irrelevant to another person at that point. So that has to do with context. The word basic just doesn't help you in a definition like this. Another thing is not just information and services, there are also skills. There are things that people need to do in self-care and in other contexts that are also quite relevant. It's not about appropriateness. We're not talking about appropriateness at all. We're talking about empowering people. We're talking about helping people make informed health decisions. And the last thing I want to just quickly point out is that the definition kind of focuses on the individual, but that's really just a very small part of how we think about this. That would be like blaming the victim in this context. It's also about anything you say about the individual, you really have to say about the context. So about the providers, about the organizations, about public health and such. So one way to get organized about this field is this simplified model. You're supposed to laugh. Thank you very much. Thank you. So this is just one way to get organized. We think about causal pathways because we want to do something about it. And if we can figure out how things work, then we can figure out maybe how to do something about it. So this is only to point out that health literacy affects how people access and utilize care. It also affects how providers and patients interact. It also has a big impact on self-care. And anything you want to say about one side, about a patient factor, you really should also contemplate what's on the other side. What are the system factors? If you say, like, the patient has their self-efficacy, well, the providers also have their communication self-efficacy too, and many of them are talking in jargon nonstop and really disempowering patients. With that, I'm going to just move ahead to say that the committee that put together this, the workshop did an excellent job, and I want to thank you, Karen, also for being a fantastic co-chair for this. We deeply appreciate the time that people put in to develop the workshop, and I'm hoping that shines through over the next period of time that we get to stay together, get to do this together. Just walk through the overview of the workshop. So the goals are to find opportunities to improve communication in cancer prevention and cancer care, and to support patients and families with low health literacy. And I want people to consider communication strategies that affect multicultural and low health literacy populations. This is by way of saying that there's a fair, robust literature developing, should be more, but it's developing, that identifies low health literacy as a critical factor in health disparities as well. And so if we do something about this, we're really also working on that problem too. Let me just move ahead and say, here's the workshop committee that I was thanking people about before. And here's what's going to happen over the next couple of days. We have sessions on, this first session was going to be an overview of health literacy communication strategy in oncology. I actually am not going to read all these things because they're in your handout and you're going to just experience them. That's how it is. It's just too much time to read all of them. Okay. So with that, I just want to go back one little thing and say, so, we want to get people to discuss this problem in a way that can focus us to think about what can be done. There's a fair amount of literature about the prevalence of these problems, and that's kind of boring at this point. It's time to think about what can be done, how to stimulate providers, healthcare organizations, and public health to improve matters. So a few just notes about how we're going to proceed. We really do want people to participate. So when you come to ask questions, if you could identify yourself, please, and your affiliation. There'll be opportunities to come to the mics to do so. And just a reminder that the whole event is being recorded and webcast as well, so people can see it later and also concurrently, but not in the room. All the best.
Thank you, Michael.